I'll also, there we go. Got our recording started. Awesome, awesome. So yeah, excited everyone's joining us today. As you continue to fill in, we ask for you to drop your name, organizations that you're joining us from, and positions, as well as what city you're joining us from. We got a lot of folks joining us up and down the state of California to talk about, once again, old system, broken response, 911 changes that Californians deserve. Awesome. We're starting to see these drop in. We got folks joining us from Madera, from the Public Health Department. Welcome. All the folks joining in. Take a few moments to let folks join in and respond in the chat. But as we do so, definitely want to welcome you in, as this webinar is hosted by public health advocates on our First Response Transformation Campaign, or you might hear it called FRTC throughout the presentation that you're going to hear today. Awesome. We got folks continuing to join in, folks from San Jose. We got folks from the Green Foundation coming in. Awesome. Love seeing this. Well, without further ado, I'll get into the presentation and start introducing you to the team that's going to be guiding you through this webinar today. I am one of your primary moderators, Ryan McClinton. I'm a program manager here in Sacramento, joined by my brother, D'Angelo Mack, our Director of Equity and Justice. And our subject matter experts, our Director of Research and Learning, Dr. Christina Gilardi, our Director of State Policy, Osama Mokadem, and one of our grad student interns who's been really helping us with our statewide policy platform, Tammy Wong, joining us today. And you'll get a chance to hear from each one of these wonderful folks as we jump into our webinar. Real quick, I'd like to give you an overview just of what Public Health Advocates is all about. Within the work that we do, which is a state policy, nonprofit community-based organization, we really focus on creating equity-focused statewide and local systems change work. We do so by challenging the unjust social, political, and economic conditions that perpetuate health inequities throughout the state of California. That work is carried forward by passing laws, reforming systems, and establishing norms that foster justice, equity, and health for all. Within the First Response Transformation Campaign, which is one of the programs we have in Public Health Advocates, our campaign focuses on rethinking local emergency response systems with a focus on equity and evolved response services that are better suited to the needs of the communities they serve, right? California is a very diverse state, and we want to make sure that the diverse needs of our community members are always met. And we do so by supporting those local cities to develop transformative approaches to the existing emergency response services rooted in residents' input. So how do we know what our community residents best need? By hearing from them. So ask you to sit tight. We're about to jump into the next part of our agenda. I'm going to introduce Dr. Christina Gilardi to talk about our public opinion polling process and some of what we heard California residents share that they want to see implemented throughout our state. Christina?
Thanks so much, Ryan. So one of the ways that we are trying to get a sense of what communities want related to first response is we conducted a public opinion poll. So if you go to the next slide, please, Ryan. So this public opinion poll was conducted in partnership with UC Berkeley and their Institute of Governmental Studies in August 2022. It included 9,254 registered California voters, and they gave their opinions about emergency first response, right? So we were really interested in understanding what folks from across the state were thinking about the needs of first response, what their community's needs were, and whether or not first response systems currently met the needs and were addressing sort of the biggest crises in the community. The poll was conducted online and available in English and Spanish. And we'll present just a few examples of the data here and provide a link at the end of the webinar with the full press kit that includes more of the data. So, for example, we asked Californians which situations are most commonly in need of emergency response surveys in their communities. Folks were able to respond to their two biggest crises that they felt were happening in their communities that people were calling 911 for. So 49% of individuals identified homelessness as the top priority, and 38% indicated that mental health was a top priority. Other options included robbery, vandalism, and property crimes, muggings, assaults, or other physical crimes against people, domestic violence, child abuse, and other forms of family violence, gun violence, physical health emergencies, and several people said that they didn't know. So these were the top two situations that folks across the state think are most commonly in need of emergency response services in their community. Next slide. We then asked, which situations do people think that local police and the sheriff's departments are least equipped to respond to, knowing that they are often the respondents of 911 calls. 67% of Californians who responded to this survey indicated that mental health was a situation that law enforcement was least equipped to respond to, and 49% said homelessness. So of the two that folks identified as being the most common need, the same two appeared as being those that law enforcement are least equipped to respond to. We also were really interested in understanding who should be responding to these crises. So we asked Californians which they would want to see their city prioritize. 69% of the respondents indicated they wanted alternative response. So 35% of those said that they would want law enforcement and behavioral health or social workers to respond together. That's called co-response. 34% said they'd like to see behavioral health respond without police. In total, though, we see 69% of folks saying we'd like to see emergency response services include behavioral health or social workers. 19% of folks said they'd like to see police respond alone to these types of issues, and then 12% said no change, the way things are working now is fine. And then we also were able to look at data by disaggregating it, which means that we're able to look at data by different demographic information. So one big question we have is who are the folks who are saying that they'd like to see alternative response? So of these 5 different race and ethnic categories, demographics, individuals said this. So 74% of white respondents indicated that they'd like to see alternative response. 69% of Black, American Indian, and Alaska Native said they'd like to see alternative response. 64% of the Asian respondents said the same, and 61% of the Latino respondents said the same. So that is the highlight of the data that we have to share with you today. We also want to say that we have the data can be broken down into these 9 regions, and these regions are determined by the Institute of Governmental Studies. But you can see here on a map sort of how they're broken down. And we can look at data by other types of demographic information. That includes race and ethnicity, like I just gave an example of. It also includes income, political affiliation, frequency of voting or recently voted, and other types of demographic information. So we are really excited to share with you the full press kit at the end of this presentation. So for now, next slide. Stay tuned for that. We'll drop a link at the end of this presentation for that. And I'm going to hand it over to Osama to talk about some of the policy work that he's been doing at the state.
Thank you, Christina. So, we've been really busy here at Public Health Advocates, in an attempt to achieve the change that we were aiming and setting out to achieve through policy solutions. And with that, Public Health Advocates is very methodical in our approach, and we have a philosophy through which we attempt to achieve this change. And to tell you a little bit more about that, is Tammy Wayne, who is our intern coming from UC Davis School of Public Health, that'll tell you more about it. Tammy, please take it away.
Hi, good morning, everyone. Thank you for joining us today. I'm just going to be talking more about the issues that face our emergency response systems today. So next slide. So two of the top issues that affect dispatchers and often prove to be obstacles in achieving effective response are call overload and slow response time. So call overload simply refers to the amount of calls coming in and their contribution in overriding the dispatch center's capacity to take those calls. And this is mostly due to the non-emergency calls being fielded the same way as emergency calls. So the lines kind of get tied up and the intake process for one call blocks the ability for those emergency calls to be taken. So while the rise of personal cell phone usage has been great for dialing 911 much easier, the system to receive the call has still relied on the same usage of the outdated technology. And finally, an issue that's not as common anymore, but still happens is the exaggerated phone calls and missed dials that are occurring. And in the same way as non-emergency calls, they are also tying up phone lines and creating slower response. So the slow response time is also the second factor. So when dispatch centers receive a high volume of calls at once, this inevitably results in slower response time from these dispatchers. And this will be especially exacerbated due to the high dropout rate of dispatchers, many of which who quit due to burnout. And this burnout disrupts the continuity in process at dispatch centers, which further contributes to the gaps in establishing momentum to bringing our systems up to date. So these two factors are also caused within the 911 system, also arise on the response end, which it can be seen in appropriate agency response. So many situations, in fact, do not require police response. As little as 3% is actually needs involve a violent crime. And so we can deduce how dangerous it is then to introduce law enforcement as first responders in situations like these, such as mental health crises, because the escalation will most likely occur where there should be none. And something that we've been more familiar with in California over the past few years is natural disasters. So the California fires, the recent flooding in Sacramento, they cause a lot of conflict within the emergency response system. They're already naturally causing this response because of the number of calls due to injuries and emergencies when dealing out with the fallout of natural disaster. But even worse now, natural disasters create blackouts within the 911 and dispatch system. So they can't even be reached now because of dead phone lines. And this will also inevitably cause the first two issues of call overload and slow response time. And finally, what we discovered through the legislative and advocacy process, which Osama will talk about a bit more shortly, is that agencies have a difficulty coordinating between counties. So all counties have a varying response protocol as it relates to emergency response, and there needs to be a collaboration between these various geographical jurisdictions, because when disaster strikes between counties, like we talked about the flooding, neighboring counties will need to be prepared to deal with these crises that cross into their jurisdiction. Next slide. And then next I'll talk about some of the challenges that we've identified in this process. First and foremost, we've realized that the data being collected and reported have an absence of common standards, and there's no way to assess the type of support requested and the appropriate response needed. So in conversations we've had with county agencies, the two issues emerged of the capacity, number one, the capacity to organize and collect standardized data, and then number two, the cost associated with collecting data. So we will mention these in the next slides, but a possible solution is partnering with research institutions like the University of California and would solve or at least mitigate these issues, because research institutions now already have a methodological approach to collecting data that could support the process for translating these data into implementation standards for our 911 systems statewide. So policy proposed, proposed as requiring, with the goal of requiring data, is not something that we've seen that's new. In fact, it's something that we've seen work well in the past. In 2001, the California legislature passed AB 636, which, oh yeah, this is the previous slide, but the 636 bill, which held county and state agencies accountable for improving outcomes for children in the welfare system by collecting data pertaining to the current outcomes of the time. So the passing of the bill meant that 58 counties were now receiving quarterly data reports of safety, permanency, and the well-being of children and families associated with the welfare system. And another instance of the positive data collection and standardization is the Racial and Identity Profiling Act of 2016, or RIPA for short. The RIPA board, which was formed as the legislation authored by Dr. Shirley Weber, or Assemblymember Dr. Shirley Weber, was charged with, among other responsibilities, collecting law enforcement stop data and having them report to the Department of Justice. So the CA RIPA board is now releasing its 6th report in 2023, which has shown empirical evidence that there is disparities in policing throughout California. So this board can now use that data and recommend best practices, reform to lawmakers, law enforcement agencies, and community advocates based on this data. And so it shows that this process doesn't have to be highly contentious or a politicized one. It's really just a gradual effort at basing our systems on these scientific methodologies. And then finally, the Transform 911 campaign. So we're sidestepping away from California a little bit. We're not the only state to have these challenges and look to these policy solutions. The state of Illinois has garnered support from stakeholders and called a shift within 911 system. The focus is building upon the 911 system. So it's building cross-field relationships, alternative first responders, and better infrastructure and technology. There's no intention of tearing the system down altogether, but rather to look at the gaps and make a transformative change for better using sound data. So in our communication with these leaders of this particular campaign, it was made clear that public health advocates' work is groundbreaking because of its collaborative intent, incorporating emergency response in state agencies, research institutions, members of the public, and other stakeholders. So back to public health advocates, we're looking at this 3-phased approach to achieving our goals within this campaign. So number 1 is to work with the state legislature to enact a program that will provide the University of California existing 911 call and dispatch data that falls within the parameters of the data points. Number 2 is working to adopt uniform data standards across the relevant California state agencies for incidence data. And number 3, working with state agencies to establish a publicly accessible data portal that will catalog statewide calls to be used for research and recommendations. So right now we're on phase 1. We're focused on phase 1 to address this issue of publicly available data. We'd like to partner with research institutions, incorporate state agencies, and have statewide coordination. And this is being done in partnership with the First Response Transformation Campaign, who are the underlying entity within public health advocates and have identified these issues and challenges and have been the driving force behind this phase plan. And so with that, I will pass it off to Osama to talk more about the real-time state policy recommendations we've made to address these issues.
Thank you so much, Tammy, for beautifully laying out our philosophy for change, which is housed within the context of the issues that we aim to address. So as suggested by Public Health Advocates' mission statement, we aim to challenge the social, political, and economic systems that perpetuate racial, economic, and health disparities. And this is done through finding upstream, innovative, and science-based policy solutions to solve our state's most detrimental disparities. So as we're all familiar with, with the barrage of public health emergencies across our state over the past several years, whether it was the COVID pandemic or the fires and storms, or even the urban climate change crisis that's still impacting our already most marginalized communities today. Public health advocates has been committed to solving these crises through effective policy change. So programs within public health advocates like the First Response Transformation Campaign, the California COVID Justice Campaign have been leading on the ground local efforts to enact policy change that we can translate into statewide policy. So as many of you may remember, last year, public health advocates ran AB 2360, and you'll see this on the next slide, in partnership with Assemblymember Dr. Arambula's office, which aimed at establishing a racial equity framework for our state's agencies to implement when responding to emergency crises. Our California COVID Justice team here at PHA was the driving force behind this. behind that particular legislation, and building on their local efforts to focus on racism as a public health crisis, recovery, repair, and economic support that will ultimately result in historically marginalized communities recovering from COVID-19. During and on the heels of the COVID-19 pandemic. So when that happened, and which it devastated our state and particularly our Black and Brown low-income and low-income communities, this bill was necessary in order to learn from our mistakes and reinforce our infrastructure to better prepare for the inevitable future emergencies that are in the horizon. And unfortunately, despite its widespread support in the legislative policy committees, our legislative and administrative leaders didn't think it was a high enough priority to allocate the dollars and invest in making it a reality. Similarly, this year, and you'll see on the screen now, we had AB 1276 in partnership with the Office of Assemblymember Tina McKinnon to create a transparent and collaborative process to analyze, fortify, and revamp our 911 response systems to better fit the needs of those calling, and to reduce the capacity strain that it adds to our emergency response agencies. And this would, this is the aim here is to approach it through a data-backed and science-based approach. This bill, as mentioned earlier by Tammy, is part of a larger effort to achieve the first part of our phased approach to policy change. In conversations with county agencies, as mentioned before, we saw that one of the biggest issues was the coordination between different emergency medical service authorities. And this is a prime example for why data needs to be made accessible in a methodological way. Through increased data to access, coupled with research-based analyses, we aim to bridge this gap between the jurisdictions that in times of emergencies. And even with this, despite our successful efforts to get the buy-in of various state agencies and the lack of opposition from any emergency response agency, the state legislature also didn't think that it was an investment that was worthwhile, which is heavily disappointing to us. We understand now more than ever that our state is gearing up for a tough financial season, but when we prepare for tough times, we need to maintain and expand our investments in the systems that will allow us to adequately respond to those tough times. The reality is we have to ask ourselves, is our state really ready to invest in this type of transformation in our emergency response infrastructure and protocol? So what's next? With the data that was discussed earlier by Dr. Gilardi, as well as the information Tammy and I shared about our philosophy for policy change, we're committed to continuing the work to reintroduce stronger legislation next year to address these issues. For example, despite AB 2360 not making it through the legislature last year, our COVID justice team has been convening a work group on their own terms to begin the process of laying out the foundation for the establishment of the structure intended by the original bill. And similarly, our first response transformation team has been working on local efforts to achieve the goals that were aimed to be achieved by the statewide bill, in collaboration with our policy efforts to continue conversations with the various state agencies consulted, as well as research institutions like the University of California, to allow us, when reintroducing this legislation that aims to solve these issues, to build on something so that there's no dead period in between the pivotal moments that we have in achieving our goals. So as we wrap up this year and ramp up for next year, our policy team will be releasing a number of action alerts, particularly in relation to these issues, for you all to engage with us on. So please keep an eye out for that. And with that, I'll hand it back to D'Angelo to close out this portion of our program.
Thank you, Osama. And good morning to everyone. Again, we just want to thank you all for joining our webinar today. We're moving into the question and answer portion of our time together. We wanted to take a few moments. If you have any questions that you can think of for either Dr. Gilardi or Osama or Tammy, please add them to the chat or to the question and answer feature. We want to thank those who sent questions in early. And so the first question I'd like to start with, I'll start with Christina. Christina, did you ask any questions in the poll about funding the 911 behavioral health responses?
We did. And Ryan, if you would mind sharing your screen again, we have a slide to share a little bit of that data. And again, more data is available. But we asked, similar to the question related to what services would you like to see, right? Would you like to see alternative response with behavioral health and social workers? And we asked the same question, but which of the following budget decisions best aligns with your vision? And we saw that 62% of folks who responded, so again, registered voters across the state of California in a representative sample, 62% said they'd like to see a shift some, most, or all of the money from police to alternative providers, right? That they feel that shift would better meet the needs of the community. 28% said they'd like to invest more money in police. This includes the folks who said that they would like to see additional training provided to police officers, right? And 10% said they'd like to see budgets left as they are. But we are seeing that 90% of individuals are really saying they'd like to see something done differently with our budgets related to first response systems.
Thanks, Christina. The next question I have here is for Osama. Osama, given that the financial considerations are what ultimately led to the two bills not making it through the legislation, how do you anticipate not running into that same issue again this coming cycle?
Yeah, thank you so much. That's a great question. So I think our approach thus far has really been to work with the various committees within the state legislature, as well as, in our analyses of the state budget, to look for different pools through which we can fund these programs. Our approach thus far, and I think, coming out of more prosperous financial times, if you want to call them that, has been to really look more general in the state budget. And kind of work heavily on the policy front in order to make sure that the policy itself and the program itself was enticing enough for it to receive funding, and then really rely on state agencies to house the programs within their various agencies, and similarly work with the governor's office in order to get that funding. Despite those efforts, I think, because it wasn't as much of a priority, it's very easy to overlook what kind of funding you want to set towards that. So our approach now is really to look for specific pools of funding, right? So rather than having a more general approach or having these programs sit or anticipate these programs to sit within the California General Fund, we're looking for very particular pools of funding and even down to line items within different agencies' funding pools to house these programs under. So this is our new approach, given that there's a forecasted deficit for the next, for the near future. So we're going to have to be really, really meticulous about where we pull the funding from.
Yeah, thank you for that, Osama. There's a couple questions in the chat that I'll get to. Let's go with the first question from Candace Bishop. It says AB 953 Racial and Identity Profiling Act. How will our communities be aware of getting information out to the communities of Stockton, California, to let their voices be heard on the matter and all matters of this Zoom meeting? So specifically things that we've talked about here, as well as legislation that's passed and flowing through the legislation system. Osama, do you want to talk a little bit about how we're getting information out?
Yeah, of course. And thank you so much, Candace, for the question. I like that you focus not only on the issues that we're talking about today, but some of the past legislation that has been that has been already in its implementation phase for several years now. So as far as the past, legislation, We'll be sharing our contact information shortly towards the end of the webinar, to reach out to us on any particular items of interest. I would suggest that that is the best way to get more information on past legislation, like the RIPA Act, for example. There are a lot of resources out there. Public Health Advocates has been tracking this legislation, tracking the implementation of this legislation. So we can definitely provide supplemental information as it pertains to that. As far as legislation like AB 1276, our 911 dispatch and data transparency legislation, as well as our racial equity framework legislation, I would say stay tuned. We will have follow-up emails, follow-up action alerts, as well as other ways to engage with public health advocates in our various programs, on those items. And the leadership within the Stockton Reach program will also likely share out that information as it's made readily available. So hopefully that answers your question.
Thanks, so. Christina, same question about the data you shared with us today. How are we planning to get that out to the greater population?
Yeah, so like I mentioned, we will at the end of this presentation share with you a link to our press kit, which includes a lot of the data that we collected. And we are working on getting all of the data uploaded onto our website so that you can look at the data for your community. We are in the process of working on some what we're referring to as 2-pagers that highlight the data across the regions as well. So hopefully there'll be some visually appealing and easy to understand 2-pagers for each of the regions that folks can turn to and understand their community a little bit better.
Thanks, KG. We're going to stay with you for this next question. And the question's from Amy. Are there any cities, counties, or states that use other forms of response teams to mental health calls? And you can see her quotations there. So this is a great question for you, FRCTC team, but take it away.
Yeah, so there are more and more popping up all the time. This is something that particularly in the last few years, we've seen more jurisdictions have interest in. What we have found is that there's not a lot of publicly available evaluation to show the impact, and that a lot of the jurisdictions aren't doing rigorous evaluation. And so having conversations with folks across the country, people who are running programs, people who are staffing programs to understand the impact on their community. So there are some programs, Cahoots is one that is really well known. There's also several others, including Denver Star, one in New Mexico, that are really starting to get traction in public awareness. I will say what we are learning is there are two kind of cool pieces of information I think that we're learning from these conversations. So one, for example, is that Denver Star started with a co-response model, meaning that law enforcement and behavioral health specialists were showing up together to calls, and that was their first step into engaging behavioral health specialists. What they have found is that over the last few years, law enforcement is actually now asking to be removed from those calls because they're finding that it is unnecessary for them to be engaged. So co-response was their first effort into this work, and now they're finding their model to remove law enforcement from those calls. And I think what's really interesting about this is that, one of the biggest concerns and pushbacks we hear around behavioral health mobile crisis response is the fear of danger for the behavioral health specialists, or if there's escalation as a result of the crisis. And models across the country are beginning to really show that concern is not substantiated. So for example, there are several programs that have been doing an evaluation, and we're in the process of trying to see if we can compile information like this across the country with programs, but fewer than 1% of calls that go to behavioral health only response for mental health and crises related to the unhoused and substance use ever require backup by law enforcement. So fewer than 1% of calls are requiring backup by law enforcement. And even a smaller percentage of those result in any injury at all. And the vast majority of those injuries are not related to the crisis at hand. They are incidental injuries, like I slammed my finger in the door, I dropped something on my foot. They are not actually because of the interaction with the crises at hand. So we are in this sort of interesting moment in time where these programs are relatively new. And there's a lot of anecdotal evidence, and some of the more longstanding programs are doing evaluation, and we're really trying to understand what they're finding. I also wanted to say I saw that there was a point in response to your question, Amy, and from Lionel, is that correct?
Mhm.
That, you know, the city council passed a motion to fund mental health crisis teams, but there isn't enough, there aren't enough people and probably budget in order to do that work. So one of the challenges that we have really identified and has sort of prompted this statewide policy effort is that the community doesn't have access to the data to find out what calls are coming into 911, period. Never mind which of those calls might be mental health or related to unhoused populations or substance use. What that does is it prevents communities from being able to get involved in the advocacy to say we want to see a shift in this budget. I think also, you know, LA County is unique because it's so large that if you look at the map that we shared earlier, it is actually a region of itself. And you can see that a large percentage, the majority of folks in a LA County want to see money shifted from law enforcement to behavioral health. So we're hoping that this data can be used by you all to do the advocacy in your community to say, look, people are saying in our community, representative sample, that we would like to see this money shifted. So we hope that it's something that you all can use as well as, you know, thinking about our statewide efforts as well.
Thank you. Thank you for that. Yeah, I think you highlighted a couple of amazing points, Christina. And I think lay folks who may not do this work, who are community champions or community members for that matter, don't really understand the data around responding. I often say, you know, it's not about the numbers we show, but it's about the story we tell from those numbers. And it's amazing when you think about the folks responding to these actual calls, law enforcement, EMT, fire. Those are the folks who have power and privilege and are capable of telling the story and holding on to the narrative. And so that's honestly why, you know, we don't understand or know this information, because the stories have been told from a place of power and privilege. And so I appreciate the questions that have been put in the chat. I'm going to ask you a question, kind of put you on the spot. I know you're good at it. Just thinking about state legislation, I know that this year we were in a deficit. It's interesting how that works. Prior 2 years, we had we were swimming in money like Scrooge McDuck the prior 2 years. I'm just wondering, what are some of the challenges that you and the policy team have come up against when thinking about bills that kind of shift narrative and tell true story and talk about true budgets going back to the people?
I think, I mean, I'm going to share a hot take, my hot take here.
Hot take.
So I think it's less about the dollars as it is about the fear around infrastructure change, right? It's very easy to pit it within the context of dollars and pit legislation against the budget and things like that. But ultimately, I think there's that fear around investment and the fallout that'll happen, you know, internally when the first step is taken to invest in infrastructure change. Because as we talk about here, as the data points towards, and, you know, as our philosophical approach shows, there are multiple phases to this process. It's not easy, and it won't be done in a day. It won't be done in a year. It won't be even done in 2 years or several years. This is a process that takes time. And with time comes increased capacity, increased involvement, and increased funding, right? So right now we're very complacent. And as Tammy touched on earlier, there's no reason why the technology that allows us to call 911 is much more advanced than the technology that allows us to process those calls.
Right.
That just like blows my mind, to be honest. So for me, it's more so that, in the free market, things are just progressing because capitalism is doing its thing. But when it comes to our agencies, there's such a slow change when it comes to updating our systems because we're so comfortable in our systems. It probably will cost a lot to overhaul our call intake system, for sure, right? But what comes with overhauling the call intake system is overhauling the processes that follow that and overhauling the systems that feeds into, right? So we're gonna have to shed, a light on all of it in order to change some of it. And I think there's a fear around that.
Yeah.
We saw that similarly with AB 2360 last year, right? Coming out of the COVID pandemic, there was no reason to deny legislation that would put into place a framework for racially equitable funding for emergency response. I know, we have a short-term memory when it comes to these things, but I'll remind folks that between 2020 and 2023, right, there were two things that were a part of everyone's daily vocabulary, right? One was a term called COVID, which is practically invisible now. It's almost ridiculous how much we've forgotten about it.
Wow.
Within within legislation. And two is racial equity. We were talking about racial equity task forces. We were talking about an office of racial equity. We're talking about racial equity protocol. We were talking about racially equitable change, right? And now it's kind of on the back burner again, right? And this public health advocates doesn't forget about these things because they're built into our core. And I think that when we talk about why things aren't funded or why a deficit may contribute to a change in priorities, it's not as much that the priorities are in contrast to the deficit to funding streams. Rather, it's more so that these things aren't a priority, right? So I think we put our money where our mouth is. We make money appear out of nowhere for things that are important to us, but it's a matter of admitting that these things aren't really important to us, right? So when we think about infrastructure change, right? And last year we saw a disproportionate amount of the bills that we supported that were specifically infrastructure related. And that's across all of our different issue areas, whether it was food and water access or racial equity, or even medical and healthcare access, right? All of them had infrastructure bills that didn't make it through the legislature and that didn't get funded, right? Whereas the other bills that were more incidental, right, that addressed symptoms of the systemic, the lack of strong, systems and infrastructure made it through. So we see that it's more so our investment strategy that we really need to revamp within our state and put trust in, right? Than it is the pools of money that are made available to us.
Yeah, you said a lot. You said a lot, brother. The infrastructure change is scary. It's like you mentioned that it is definitely scary, specifically for those who infrastructure has worked for so many years, right? Yeah, I definitely echo everything you said around the fear, and also just the need and time for change. I think as we're looking at the data, specifically the opinion poll we just got back, we're seeing folks crying for something different, right? It's not a certain set of people. It's not a certain. It's the majority of folks understand that the system is old and outdated, and it's not supporting the best majority of our population. And so, thank you for lifting up those thoughts. We have a couple other comments and questions in the chat. I want to go back to a comment that was made. I think Rachel made a comment here, and I want Christina, I think you would like to respond there, if I'm correct. Yeah, okay, go ahead.
Yeah. Thanks so much, Rachel, for your comment. I think that there is, a lot of concern about what is being reported related to increase in crimes in California, especially during COVID. And that's often a talking point or a sticking point when having conversations about alternative response. So I wanted to just talk about it a little bit. And I think it's really about using that information as well as the information related to behavioral health crises and mental health crises, and the public opinion poll to best meet the needs of the community. And when we have access to 911 call data as community members, not just the data that is presented, if it's presented at all by law enforcement, we really get to ask questions about which are the services that are best needed. So I think, like, to Osama's point, he's really talking about the infrastructure that is needed to help create seamless systems that are responding as needed. So one of the things that Tammy talked about earlier was related to call overload and response times. And those are all part of the challenge, especially because, as Tammy presented, only 3% of calls going to 911 are related to violent crimes. So imagine if all of the calls that were not related to violent crimes in progress, or many of them, could be handed off to other folks. Law enforcement would be available to address those most pressing crimes that they are best suited to respond to. And so I think when we talk about alternative response, we're really not saying in many circumstances that law enforcement are never needed, right? There are certainly folks who are calling for that, and that's okay. And also, what we are really trying to say is that law enforcement are very uniquely trained for very specific types of calls and crises. And the vast majority of things that they respond to don't align with that training or their interest, right? They didn't become social workers or behavioral health specialists, right? That was not their intention. And they're being sent to respond to these. So when we look at budgets recently, we talk to local government agencies and law enforcement, we hear that there is a lot of unfilled positions, that they're having a hard time recruiting, that their officers are working lots of overtime, right? Again, we don't want law enforcement working lots of overtime. We know the drain on that on an individual. We know how that affects their ability to respond in crises. And so what we're talking about is using data, getting access to data so that we can best align responder to crisis. And that includes making sure that we have behavioral health response available and reducing the types of calls that law enforcement have to respond to. I hope that helps to sort of frame our thinking. I don't know if anyone else from our team wants to add to that.
Go ahead, O.
Yeah, I was just going to add, and this isn't something new. This isn't something we're just saying. This isn't something that, this reality that we've concocted that's not reflective of the reality outside. Earlier this year, there was an LA Times article in which Craig Lally, who was the president of the Los Angeles Police Protective League, which is the LAPD's biggest union, literally said that police officers are sent to too many calls that are better suited for unarmed service providers. Right. So this isn't, public health advocates that, are, creating this stuff for whatever agenda. It's really something that our systems are suffering from. And because we don't know where the data is pointing, it's very hard for us to, make adequate and efficient recommendations to our emergency response agencies. And that's the whole philosophy and aim behind what we're doing here with this.
Great point. Yeah, I truly believe, you know, as we're seeing the article come out in Los Angeles from the police union there, and other places across the nation, it's really a time issue. We're going to have to give time. There's a lot of things that we can present specifically in this country that just make sense. And we are pulling our hair out wondering why these things aren't implemented. I do see major statements and changes happening, but there's definitely more that needs to be done. And I think the more happens with us, individuals who, like folks who presented, like folks who are on the call, it begins with, again, like I mentioned earlier, taking back our narrative and making sure we're sharing that as much as we possibly can. We want to, Ryan, if you could put the slide up. I don't have any further questions here, but I want to share with you, if you'd like more information or to review the data we've provided, or to read through our press kit, we have a QR code here that you can scan, and we can go ahead and get you that information. We also, Christina, I didn't give you the opportunity to share, but disaggregated data, if you want to mention that to the folks, sharing the disaggregated data regional-wise.
Sure. So we can disaggregate the data at the statewide level. Unfortunately, we can't disaggregate. So two thoughts. We can share disaggregated data at the statewide level, right? So we can look at it, like I had mentioned, by geographic area, race, ethnicity, and political party, for example. And then at the regional level, so for San Diego, for example, we are not able to then further disaggregate it just because the data is representative. Happy to talk offline with folks if you're interested more in what that means. But we did want to share a little bit more of the disaggregated data in case you're interested. So we had mentioned that, 67% of voters think that law enforcement is least equipped to respond to mental health crises, for example. And you can see here that the majority across demographic breakdown, by region, by race, ethnicity, and by political party, all show the majority of individuals, right, think this to be true, that they're least equipped to respond to mental health crises. So we can often make this a political issue, for example, or we can make it a race issue, or we can say this part of the state versus that part of the state. Mm-hmm. But this 67% really does span the majority of the residents who responded to this survey. Of course, there are folks who, said absolutely they are equipped, and there are folks that said no. But when we look at the average across the demographic information, we do see that this is representative despite demographic information. And the same is true when you look at voters wanting mental health professionals or social workers to respond and be included in 911 for nonviolent crimes. So again, we presented 69% of voters want that. And you can see the same is true across geographic area, race, ethnicity, and political affiliation, with more than half of every one of those demographic breakdowns wanting to see mental health and social workers involved in 911 response.
Thank you so much, Christina, for including that. I just want to go back because April Jean had a comment/question in the chat, which is something that we've been talking about with FRTC for some time. And it's honestly what Christina was talking about, changing the narrative. There's an approach that, there's many approaches, but there's an approach that we have thought about when thinking about how we support our communities through alternative responses. We know that the purse strings are being held by the city for police and fire. And we also know that the work that they're doing, the extra burdened work that they're not trained to do, is also a tax on their health. And so April lifted up the question about including future policy around supporting the health and well-being of law enforcement and first responders. And I just think that's the type of thinking that we have to think about and really pursue. So often when we're talking about shifting dollars and supporting community, how we know community needs to be supported, the language that's heard is get rid of us, right? Or take our money. At some point that may be the case, but we know we're realists as well, and know that the first part is really supporting everyone involved, and supporting everyone involved looks like taking these extra issues that law enforcement are not trained to do, that is causing some major health issues and some very negative statistics with that actual group away. And so, yes, I think future policy will look like, how do we better support the well-being and mental health of first responders, including law enforcement and fire. So on your screen now is a closing poll that we'd love for you to take. It's very short. If you could just go ahead and fill that out, that will be tremendously helpful for the team. And our hope is that we can continue this conversation very soon, and also include you and your respective cities in this conversation as well. I want to give Ryan the opportunity to say any closing words before we hop off. But we want to, of course, thank you all for joining us for this time. We thank Osama, we thank Christina and Tammy for their presentation today. Ryan?
Yeah, thank you, D'Angelo, and thank you, Osama and Christina, for really a phenomenal, as well as Tammy Wang for an amazing presentation, not only on our public opinion polling data, but also our approaches and strategies from a policy standpoint. I want to also give a great big shout out to all the attendees today. Something I like to do on the back end of these types of webinars is what we call a chat waterfall. And the way that I want to do that today is I'd like to see emojis around how you're celebrating, one, the panelists that are here, but two, yourself for coming. How are you giving yourself flowers? So I like to see emojis. Everybody, if you can take a moment after you finish the polls, because we want to get that feedback, to drop an emoji in the chat of how you're feeling at the conclusion of this webinar today. If we do this all in the same time, you'll start seeing it just kind of cascade down, and it gives a lot of great joy to it as well. Let's go, let's go. Okay, I'm seeing fire emojis, hugs, butterflies, let's go. Yes, yes, yes. This is the type of energy that we want to see from our residents, our California residents, and how do we transform our systems that impact our lives directly, right? We heard a lot of great information today, and the reactions coming through in the chat reflect that type of energy that we're hoping to continue carrying forward. As we get ready to close out the poll, I want to give folks a few more moments to fill that out as we're continuing this Zoom waterfall. We want to show on the screen our contact information. So if you have any questions, if you'd like to contact us further, here's our contact information for our staff here at Public Health Advocates, Osama, D'Angelo, Dr. Gilardi, and myself, Ryan McClinton. We truly thank you all for participating in this webinar. We will be following up with a number of you with some next steps, as well as some hopefully fruitful conversations to engage to work on a local level. Big appreciation again to you all. Thank you for participating. Thank you for dropping the love in the chat. Thank you for the great questions and the engagement. And this will be the first of many lunch and learn opportunities and webinars that we have coming forward. So thank you all, and we bid you a wonderful day. Awesome, awesome, awesome. All right. Pull down the thank you screen in case anybody didn't have a chance to capture the information.